Today I'm going to show you what bioidentical hormone therapy can look like, and I have visuals for you. So first off, I have what are called troches. And troches are little dissolvables, almost same concept maybe as a cough drop, but not quite as gross tasting and easier to dissolve. And troches is just a modality where a compounding pharmacist can put in hormones that then in your particular dosing can be absorbed through your tissue in your mouth. So it goes into the capillaries either under your tongue or between your cheek and your gums and goes straight into your bloodstream. So these are not pills, you're not chewing them or swallowing them. And in fact, the goal is not to swallow them, it's to let the hormone absorb into your bloodstream through those capillaries in your mouth. And these are what they look like. I mean, they're gonna look different depending on which pharmacy you go through. But these come in this little case, and each troche is a clear little square in here. I have one removed, you can see the rest are in there. And what they look like when I pull them out is this little square. And you're not gonna be able to tell from my video, but the cool thing about these squares is that they're scored. And so when I'm starting somebody out on hormones and I'm not sure which dose is going to be best for them, we can start small by having them just cut these in half or even in quarters to take it. And then they can increase the dose or decrease the dose as they need to without me having to call in a brand new prescription. And I can tell the pharmacist exactly how much testosterone or how much estradiol, or we can put both of them in there at specific doses that can be customized to you. So again, you just take this and you put it either under your tongue or between your tongue and cheek. The troches do take a little bit longer to absorb, so sometimes even 10 to 15 minutes. So that is one downside. If you just don't want to have this in your mouth that long, it may not be the best choice for you, but to get the best absorption, you do need to commit to letting the whole thing dissolve. Along those same lines is something called a rapid dissolvable tablet, RDT, or sometimes they can be called triturates. I have no idea what that word what that actually means, but some do call it triturates. And they are same concept as the troche, where we compound estrogen and testosterone or a combination of both into there. But these RDTs dissolve a lot faster. So the benefit to these above troches is that you're dissolving them and you're not having to have them in your mouth as long. You still just keep them under your tongue or between your tongue and cheek. Here is what they look like. So here's a little packet. And to me, they look almost like a Tums tablet, but a little bit smaller and almost kind of chalky. So here's an example. Looks actually like a gumdrop when I'm looking in the video, but they dissolve really fast. So if I were gonna wanna cut these in half, it'll crumble and go everywhere. So the difference between these and troches, they're gonna dissolve faster, but there's not as much leeway in being able to cut them in half or divide them. If you want to try to see what dosage you're on, you kind of get the dosage that we prescribe in here. But once you've landed on a good dosage, then these are great to stick with because they're quicker. The flavors are going to be different based on the pharmacy. Some people are sensitive to certain ingredients, so those are things that we're cognizant of when we're prescribing these too. But again, you don't swallow them, you don't chew them, you just dissolve them, and then those hormones go straight into your bloodstream. Another option is cream, and compounded cream can also contain many different types of hormones, and we just prescribe the exact dosage for you, and it can be one hormone or a combination of hormones in the cream. And the cream can be either transdermal, meaning it goes on your skin, or transvaginal, meaning you put it in the vaginal area and it absorbs through the vaginal tissue. Today I have an example of transdermal cream, and this is what one looks like. I mean, again, the containers can be different based on what pharmacy you're using, but this is a pretty typical container. This one's actually, I like this one a lot. It's pretty accurate and it's easier to use. But what you do with this is you can take off the top and you can see these holes there. That's where the cream is going to come out. And this one, I just don't have it all the way up to the top, but typically it's gonna just look white because every time you use it, that cream's gonna be pushed to the top. And then you use the cream that's comes out of the canister, and then it's ready for you to use again. So it's not as complicated to figure out the dosing because of the way that this container works. So how you do this is your prescription is going to say do 1 click a day or 2 clicks a day. A click means just one of these clicks. So you can hear it, I'll do it again. So that was 2 clicks worth, which then gives me my cream here. And then you actually take this and then you can rub this wherever you're going to use it. So usually with transdermal cream, you're going to use it on the thinner areas of skin. So inner thigh, maybe inner arm, forearm. You do have to be careful with this cream though, because you don't want to put it, say, on your forearm and then hold a baby or touch somebody else. You don't want it to get onto anybody else. So that is a downside of the cream, but inner thigh seems to work pretty well for people. And with the cream, the cool thing is because you can dose in clicks, I can tell somebody to start with 1 click, and then if we need to go up, we can still use that same container, but then I can tell them to then go to 2 clicks or go to 4 clicks without getting a new prescription. So those are some examples of bioidentical hormones. Again, there are other options, but I wanted to tell you the most common ones that I see.